The next dissection is basically skinning the upper and lower limbs. During this skinning process, the only things that we want to make sure that you find are some of the cutaneous vessels, veins, that will be coursing under the skin and draining the cutaneous surfaces of the upper and lower limbs. There are two vessels in the upper limb that you need to be aware of. One is the cephalic vein and the other is the basilic vein. The cephalic vein drains the anterior and posterior aspects of the lateral hand and basically courses along the lateral border of the forearm and arm to the point where it drains into the subclavian vein up here in the neck. The basilic vein drains the medial anterior and posterior borders of the forearm and hand and runs along the medial border and then ultimately drains into the brachial vein along the medial side of the arm. There's a vein that joins between the cephalic and the basilic vein known as the median cubital vein, which is generally found right in the region of the elbow and is commonly used for taking blood. You should be aware that there are also some cutaneous nerves that travel with these veins, which we're not going to spend a lot of time finding, but they are branches of the brachial plexus that will supply cutaneous innervation to the skin along the approximate same distribution. To take the skin off of the arm, forearm, and posterior or dorsal surface of the hand, you'll make a longitudinal cut on the anterolateral surface of the arm and continue it down under the forearm, and then undermine the skin, and using your fingers you can peel the skin off in one big swatch. Watch for the position of the cephalic vein in the underlying surface of the skin, and once you find that cephalic vein, you can just make sure that you don't destroy it as you remove the rest of the skin. After completion of the skinning, you should be able to find the course of the cephalic veins and the basilic veins along with their associated cutaneous nerves. The cephalic vein drains into the subclavian vein by forming a groove between the pectoralis major muscle and the deltoid, and you can see that it courses along the anterior lateral aspect of the arm and forearm down to the lateral aspect of the hand. There's a small branch between the cephalic vein and the basilic vein known as the median cubital vein. This vein is important because it's commonly used for drawing blood. The basilic vein on the medial side of the arm drains into the brachial vein and can be seen here as it dives deep into the arm, draining into the brachial. And you can follow the basilic vein down as it continues on to the forearm on the medial aspect of the forearm. Both of these cutaneous veins travel with some cutaneous nerves. The nerve that travels with the cephalic vein is the lateral antebrachial cutaneous, a branch of the brachial plexus, and the nerve that travels with the basilic vein is the medial antebrachial cutaneous, also a branch of the brachial plexus. The second part of the dissection is to remove the skin from the lower limb. And just as in the upper limb, there are two cutaneous vessels, two cutaneous veins that you need to be aware of that drain the skin of the lower limb. One vein on the medial side of the leg and thigh is the saphenous vein, or greater saphenous vein, which courses just anterior to the medial malleolus and follows the course along the medial leg, just behind the knee, and on into the thigh on the medial surface of the thigh, where it ultimately drains into the femoral vein in the femoral triangle. The other vein is on the posterior aspect of the leg and is known as the lesser saphenous vein and is difficult to see in this position, but basically it courses on the posterior side of the leg and drains into the popliteal vein behind the knee. There are additional cutaneous nerves which travel with these two veins, which again we're not going to be worrying about too much, but you should be aware that there is a nerve that travels with each of these veins if you ever have to do any work on these veins for things like harvesting for coronary artery bypass. After you've identified the position of the veins, you can begin by taking this skin of the thigh and leg off in large strips, just as you did in the upper limb. and take it off all the way down to the dorsal aspect of the foot, but don't worry about the plantar aspect of the foot at this time. When you're taking off the skin, be careful of the underlying deep fascia, which is much thicker in the thigh and leg, and a thickening of this fascia forms a structure known as the iliotibial band that's traveling on the lateral side of the thigh and is something that we don't want you to destroy at this time. After removal of the skin on the lower limb, you should follow the course of the saphenous vein and the greater saphenous vein and the saphenous nerve down the thigh, leg, and onto the anteromedial surface of the foot. This dissection shows the greater saphenous vein as it courses along the medial surface of the thigh, behind the knee, and down on the medial surface of the leg, where it travels just anterior to the medial malleolus. This is a good landmark because sometimes this vein needs to be accessed at this point for a cut down. The nerve that travels with the greater saphenous vein is the saphenous nerve. It's a continuation of the femoral nerve, and it forms a cutaneous branch that travels just along with the greater saphenous vein. And you can see it here as it courses onto the medial aspect of the leg and onto the anteromedial aspect of the foot. On the posterior aspect of the leg, you can see the other two important structures. The sural nerve, which is a cutaneous branch coming from both the common peroneal and the tibial, which travels down on the posterior aspect of the leg and onto the lateral aspect of the foot. And the vein that travels with this, the lesser saphenous vein, which follows the exact same course behind the lateral malleolus. This vein drains into the popliteal vein at the back of the knee.